Hey, Dr. Rob Letizia from Spectrum Therapeutics. I've been practicing orthopedic manual physical therapy for over 20 years. We're located in Wayne, New Jersey, and today we want to discuss one of the most common causes of low back pain, which is the herniated disc. So you want to think of a disc like a raw egg. So here is the anatomy of a disc, which this is the shell, and then you have the yolk, which is the soft portion of the disc, which is what will cause the herniated environment. Now, what happens in normal time is we do everything in front of us, so pressure tends to build on the front portion of the disc, migrating the yolk or the soft portion of the disc towards the back. And then it would just take a sneeze or a bend forward or something out of the ordinary to push that soft material beyond its threshold, causing that herniated disc, or the air quotes of "my back went out." People will experience pain. They will also experience being stuck in a certain position. These positions can be easily dealt with a skilled physician like myself, doing position type therapy and other sorts of hands-on techniques that we like to utilize here at Spectrum. All right, so if the disc is migrated to the back, which is right here, you can see that illustrated, what's going to happen is the person is going to be bent forward and to the left, away from the herniation. So you want to use pressure and time to reduce that disc. So we would then lay the person down on their belly and try to allow enough pressure to build on the back portion of the spine, forcing the disc away from the painful receptors. And that kind of looks like that. So things you want to avoid if you find yourself having this sort of pain scenario or herniated disc is you want to avoid rest or staying still. A lot of people will tell you to rest, but in fact you will make yourself worse because you need to keep the disc in motion. That's the idea for the exercises, which are designed to reduce the herniated disc. So if you keep moving, you sit for a little while, but then you get up every 10 or 15 minutes and go for a little walk. You stand for a little bit, then sit back down, then lay back down. You're constantly changing position. That's more healthy for a herniated or diseased disc than just laying down and not moving at all. You also want to avoid poor postures and repetitive bending forward and or lifting and repetitive lifting. So Josh is having a low back pain from a herniated disc. So we're going to take him through the few phases that we would do normally if you were here at the clinic. So the first phase is just laying on your belly or lying prone. What that's going to do is start to build pressure in his low back in this area, forcing the disc straight down towards his belly. The second phase of that, if this were okay and the pain started subsiding, is we're going to prop you up on your elbows. So bring your elbows in, creating more of an arch there, so thereby increasing the pressure that we're putting on that disc that has herniated towards the back of the spine. And once that starts to feel okay, we're then going to have you come flat down, hands in a push-up position, but just above shoulder level, and you're going to go ahead and press your chest up off the table or floor, straightening your elbows, putting an arch in your lower back. So get those elbows up straight. Yep, there you go. Now that exponentially increases the extension force caused by the herniation migrating towards the back, thereby allowing the disc to migrate back towards the floor or his belly, reducing that herniation. And then come down. And those are the three phases of herniation. So if you are experiencing a herniated disc, give us a call today or stop by the clinic. We are located in Wayne, New Jersey. This is Spectrum Therapeutics.